Hi, I'm Dr. Melodie Zamora. I am a board-certified obstetrician gynecologist, and I'm currently working at Innovative Women's OBGYN. The way that I approach birth control really depends on the way the person who is presenting themselves, because there are a lot of different people who want birth control. I have had patients that are very early in their teens and are people who are all the way very close to menopause but are at age 50 still having periods. And then the different types of contraceptions that we have. So there are a lot of hormonal contraceptives. I actually really go through the entire list of potential contraceptives. So for example, if you are, an adolescent, first time, so I ask them if they have any other potential reasons to be on birth control, because we can use contraceptives in a non-contraceptive manner. For example, acne. Some people come in and have really bad acne. They've seen their dermatologist and they say, go see gynecology because they can help you with that. Because acne can be hormonally related. And so that may be a potential reason to be on birth control. And so it would eliminate certain options because there are only specific birth controls that are going to help that problem. The other example is maybe they just have really heavy periods. And so that may elicit the need for something that's a little bit more of a higher dose birth control pill version, or something that's more of a long-term one. Some patients, again, the delivery method is important for them. They are, nope, I really just suck at taking pills. I'm not going to remember. If you don't remember on a daily basis, well, then it's not going to be effective. So then the pills are kind of ruled out. You can get into different options. One is like a patch. The other one is a ring. That is something that women have to be particularly okay and confident in themselves, because they have to actually put that in their own vagina to make that effective and work. And so if you're not really comfortable with your body in that aspect, which some women aren't, then it's not their option. And right now, we really do push for what are called the long-acting reversible contraceptives, or the LARCs. Those are the ones that I kind of tend to clump into the one-and-done deals. You get it placed, and it can stay in for years. And there are two versions of that. They're devices. One is one that goes inside your arm. That one is called the Nexplanon. And it is just a progesterone-only birth control that's good for 3 years. So it's very popular in that adolescent group because they don't like the other device, which goes inside your uterus. So no one really likes that idea a whole bunch in that young population. So the one in your arm seems more tolerable, more palatable for the adolescents, whereas people that are more into their reproductive years think the IUD is much easier, because a lot of the good possibilities of the IUD is that it decreases bleeding, maybe even gets no periods, and it's actually approved for much longer. So there are actually a few different types of IUDs, as I was mentioning, and those are a little bit longer compared to the one in your arm that be anywhere from 3 years to technically FDA approved for up to 8 years at this time. And then there's actually one that is completely non-hormonal, an intrauterine device, the IUD, for 10 years. And so that a lot of women will come in wanting to know a little bit more information, because it is the only non-hormonal device that we have. So people who really are adverse to hormonal contraceptive will kind of go in that route as well. The other one is an injection. That's kind of the last on the list of different availabilities. And that injection is every 3 months. And again, progesterone only. So you start looking at the delivery method. You talk to people about the hormones, so the pills, the patch, and the ring. Those have combination estrogen and progesterone, and those potentially have different side effects compared to the progesterone only. And then again, going back to the one that has no hormone whatsoever. Remember, all of these are great for certain people and maybe not so great for other people. And a lot of the times I do tell patients, I'm sorry, but we might have to go through a trial and error depending on what we're trying to solve, if it's not just birth control.